Howdy, y'all. Denise Fleck, Pet Safety Crusader here, and today we are taking pages 220 and 221 out of the Pet Safety Bible to discuss puncture wounds, or more specifically, bite wounds. It's getting warmer outside. Dogs and cats may have been kind of closed up or experiencing some spring fever. They're going to get out and about. Maybe we've forgotten to remind them of some of their manners, don't have them on their leash, haven't practiced some of those training tips that they need to be refreshed all the time. And for whatever reason, our animals are getting into a squabble. Well, very often we think, we take the two dogs apart or we get the cats and there's no blood. So we say, thank God, nobody got hurt. Well, don't, be fooled by that. Wounds can often be disguised by all the fur on their body. And if you don't care for them, they can turn into an abscess in just a couple of days, which is literally bacteria that wells up under the skin, and it can become a very nasty infection. Sometimes it has to go as far as to have drains put in. So it's, can become a real surgical procedure. So anytime you safely get pets apart after some sort of fight or entanglement, obviously that's for another time how to do so safely, but really check them over. Don't assume that nobody got bitten. Cats with their needle-like hypodermic type teeth, whether they penetrate our skin or another cat's skin or a dog's skin, when those teeth pull out, the tissue starts to close up very quickly, but often that saliva from their mouth gets trapped underneath. Statistically, when a human is bitten by a dog, about 5% of the time we get an infection. With cat bites, that number is way over 50%, just for the reasons I mentioned, those hypodermic type teeth that really penetrate. And there's just something about kitty saliva that doesn't agree with a lot of humans. It's just so important. And I know I'm really talking about, animals getting bitten today, but let me just put this out here that when we do get bitten by an animal, get out that chlorhexidine, that pink antibacterial soap. You may find it in your drugstore under the name of Hibiclens, Hibiclens. Sometimes it's also kind of a bluish color too. But wash with that, and I kid you not, keep that water running for 10 to 15 minutes. Just washing, like they say in the restaurants where it is supposed to remind you to wash your hands to the tune of happy birthday, is not sufficient when you or an animal is bitten by another animal. You really need to flush that wound for 10 to 15 minutes with the chlorhexidine as well as that water, because the tissues close up so quickly and an abscess can happen. So let me just take you back to that step again. Don't assume that if you don't see blood, an animal wasn't bitten, that they just, did a lot of growling and hissing. There could still be a wound. That fur often hides it. So give your pet a head to tail checkup, watch their face. If you hit a sore spot, you're going to see a little grimace unless you actually hear a guttural growl or a hiss, because it's really that sore. Obviously, keep kitties indoors. Keep your dogs on leash. I wrote a really good blog a while back. I can repost it here, but how to protect your on-leash dog. Because so many of us are doing the right thing, whether we're pet owners, pet sitters, dog trainers, but then there's a stray dog out and about, or somebody that just thinks it's so fun to unclip their dog's leash and let him run over to the dog that you have on leash. And it's so important that we just stay aware, besides having, pets on leash, that we're staying very aware of our environment. So if a squabble does pursue, what you want to do is feel, the pet all over if you're not seeing an actual wound. If you do see the wound and it's bleeding, that's actually a good thing, as much as we don't want the pet to lose a lot of blood, but as things bleed, they clean themselves out. So that means that wasn't a particular wound that closed back up, and you hopefully won't be looking at an abscess situation. Anytime you're cleaning out a wound, the most sterile water you can find is the best bet. Do not ever pour hydrogen peroxide into a deep wound. We just never do that for a bite wound or a puncture of any kind. If you or a pet steps on a nail or, a stick or anything penetrates, don't pour hydrogen peroxide. Use that clean water and that chlorhexidine that I keep talking about that you may find is either pink or blue, but that antibacterial soap. Treat the pet for shock if needed. All of you should know how to do that. You know, on us humans, we press on the nail beds, but on our pets, we lift the lip and we press on the gum. And if the gums are already pale, or if it takes 2 seconds or more for that bubblegum pink color to come back, we are concerned about our pet's circulation. So we're going to treat for shock by, as we're transporting them to the vet, elevating their hindquarters, the big meaty part of their body where a lot of blood pools. We want to make sure it goes to all the major organs in the brain. So a folded up blanket, a small pillow, something underneath to just lift that back end and send the blood forward. Except if that bite wound is in the chest or the head, then you certainly don't want to be sending blood out of the body. But otherwise do that. But at the very least, cover the pet. Because if he is going into shock, that means his blood isn't circulated, and it's like his thermostat is off. He can't modulate his own temperature. So even on a warm day, just a light sheet will help him keep his body temperature normal. You can also rub the gums with like some Karo syrup, some honey, even some pancake syrup if you happen to have that. If it's a wound that is bleeding profusely, you know, and you're trying to get the bleeding to stop, you know, my bandaging tips, they're also on the blog, but apply direct pressure to wherever it is with a clean gauze, a clean sock, feminine product, a folded up t-shirt, anything along those lines to get the bleeding to stop. And in that case, we would then elevate that area and possibly even press on a pressure point. So, you know, our dogs and cats have those 5 pressure points. I hope I'm reminding you of all these things so that they'll come to your brain more readily should you actually need them. One of the pressure points is inside each leg, and the 5th one is at the base of the tail, underneath the tail. So depending on where the injury is, we can press on that pressure point, and it's like squeezing down a straw. You don't want to tie it off completely, but you're trying to minimize the blood flow through that limb so that less blood will go through and bleed out of the body, giving the dog or cat time to actually clot. Now, God forbid, it's what we call a sucking wound to the chest. Anytime something penetrates the chest, and that can very well be a tooth, even a claw, what happens is it de-equalizes the pressure. It protrudes, and then the pressure it deflates the lung, and then the lung can't refill, so the pet can actually suffocate. So you may not know exactly what's happening, but if you're seeing a wound anywhere in the area of the chest, and actually if you're seeing like the blood bubble, or you're hearing, you know, bubbles, or it's almost like a little bit of a gas escape, you might see foam in the blood right around the chest. What you want to do as well, you know, the steps we talked about, treat the pet for shock, but then put a gauze over it. Or what's even better is if you have some KY jelly or Vaseline, if it's a small wound, to seal that wound. If it's larger, take your gauze and some saran wrap, or even something like just a baggie. And what's best is if you can actually tape it down on only 3 sides, just on 3 sides, because then what that does is allows this end, as the pet inhales and exhales, it allows the plastic to lift, and then it comes back down as he inhales, so not too much air gets sucked into that lung, collapsing it. In many cases on a pet, it's often good as you're transporting them, if it is a sucking wound of the chest, to actually get them to on that side where the wound is. Now it depends, you have to analyze this, because generally when we're talking about doing direct pressure or stopping bleeding, we're always having the wound elevated. But in this case, the idea is that the weight of the body compressing against a board or whatever hard surface you have the pet on is creating that direct pressure. But you obviously have to be so careful to see that that is actually what's happening, and that you're not allowing blood to escape from the body. But what I just want to leave you with is, you know, like humans, pets get into squabbles. So we want to do our doggone best to make sure it doesn't happen. If you have cats roaming stray, and you know it is now kitten season, mating is in the air, it's liable to happen. If dogs are loose, you know, they can always get in a tiff. And I know sometimes no matter how hard we try, something happens. The dog jumps the fence, he digs his way out, he's loose, he gets into somebody else's territory. You know, things do happen. I get that. But do all you can to prevent that from happening. I am going to add to this my blog on how to protect your on-leash dog, just in case any of you need refreshers on that, because, you know, we're all back outside. I know some of my pet sitting friends, I see them here today, have been walking 365 days. They didn't stop if it was cold or rainy or anything else. But some people, you know, haven't been doing as many jaunts with their pet during the inclement weather, as we'll say. But now that it's getting beautiful in most places, you're out and about. So remember, you need to be reminded of your dog handling skills, as well as the dog needs to be reminded of his on-leash skills and obeying and listening to commands. We all do better when we have a few rules that we abide by. But, you know, stuff does happen. So remember, number one thing is to clean out that wound, whether it's on you or on your pet, if you are bitten by an animal, and really flush that wound, but no to hydrogen peroxide. I'm going to keep paws and fingers crossed that nobody gets into a squabble with anybody on 2 legs, 4 legs, feathers, or fins, and that you have an awesome rest of your day. But stay tuned, and we'll keep covering items of interest to keep our pets safe and help them live longer, happier, healthier lives with us. Take care for now. Bye-bye.